Hi everyone, this is Dr. Dennis Matzkin at Allied Eye in Chattanooga, and this is our second Facebook live event. And happy for all of you to tune in, tell your friends about us, because once a month we're just chit-chatting about various eye-related conditions, disorders that may be of interest to you and the general community. Since we last had a Facebook Live event, a lot's happened here in Chattanooga with a tornado just missing our office. We were without power for 2 or 3 days here at the office, and many of our patients just up the road, not even a quarter of a mile, were severely devastated, and we really feel for these people that lost their homes and had to relocate temporarily while their houses were put in order. Fortunately, um, we're not aware of any of our patients losing their lives or getting severely injured, but again, our hearts go out to those that were involved in the tornado. Coronavirus is still everywhere, and we are taking a lot of precautions as per CDC recommendations here in the office. Patients are still waiting out in their cars until we call them in to the office. We're trying to limit the number of people in the office and have any escort or driver that you may have with you stay in the car unless we need them for mobility issues or translation. We wear masks in the office and scrub down everything as best as we can. And to our knowledge, we haven't had any corona incidents here in our office. Any of our staff members that have been in contact with any corona patients, we've asked them to quarantine at home, get tested, and we've had one or two had to stay at home and their tests have been negative. With having said all that, I do want to talk about Health Month Vision in May. May is Vision Month, and so I think it's just appropriate to chat a little bit about some reasons that everybody should think about having a regular eye exam. You know, just you go along your merry lives and you just put everything aside. I don't need my eyes checked. I don't need my eyes checked until something devastating occurs. You lose vision. You have pain. You're not seeing as well as you might wish to see, and come to the eye doctor, and a lot of damage may have been done that could have been prevented early on. And I'm just going to divide that routine eye exam into childhood and adulthood. I generally do not see children, but it always is very upsetting to me when I'm seeing adults that tell me they had a lazy eye diagnosed when they were young and it wasn't treated appropriately. And that eye, the one eye, consequently has very poor vision, and there's not a lot that I can do about a lazy eye that was not treated appropriately in childhood. So any of you that may be watching that have children, grandchildren, that are young, 3 years of age, they should have their eyes checked no matter what, either by the pediatrician, an optometrist, an ophthalmologist. The eye may not be wandering, it may be a straight eye, but still, if the two eyes are unequal in prescription, usually in far-sighted kids, the far-sighted eye will tend to be lazy. It won't want to focus, and over time, when it becomes lazy, that eye will drift either inwards or outwards. Now that can be addressed in childhood with patching, with eye drops, with glasses. If you wait until the kid is over 9 or 10 years old, you've missed the boat. And that eye that wasn't treated effectively for a lazy eye will never see well, no matter if we straighten the eye surgically and remove a cataract or do whatever needs to be done, that eye will never see well. So I urge every one of you, any kids, make sure they get an eye exam by the age of 3 or 4. Do not wait till 9 or 10. Okay, so let's move on to adults. Why should we have an eye exam just as a normal part of your routine healthcare? Well, here in the office I see patients from all walks of life and with all sorts of different issues. And one thing we often see is patients who come in with headache. And a patient that comes and sees me with headache, and without even taking a full story, when I see these little frown lines in there, and they're like this, and they say, "Oh, doc, I get a headache. I've got headaches all day long." I know for sure the reason why they have these frown lines is that they're squinting. They try to focus hard to see clearly. And often it's far-sighted people who've got very thick glasses, far-sighted. They can see great way off in the distance. But when they're looking at the computer screen, or they pick up their cell phone or their iPad, they're squinting to see, and they may not even realize it. Usually these symptoms start at the age of about 30. If you're far-sighted, you'll have symptoms at 30, not at 40. And a simple eye exam can pick that up and possibly treat your headaches and eye strain and fatigue. Headaches are obviously a sign of some mischief going on in the brain, and if the pressure in the brain is elevated, you may have headaches, you may lose vision transiently, you may have double vision, and by a careful examination of the eyes and your side vision, we can pick up that abnormality, even when it's not very advanced. So some patients actually come in for a routine exam, and we can pick up swollen nerve, loss of side vision, and you may even have a brain tumor that you're not even aware of. But a routine eye exam can pick that up in various by doing various clinical tests and special tests. Many people come in and they're not even aware that they're blinking a lot, or they've got mild red eyes, or they're rubbing the eyes, or they're constantly watering and constantly wiping the eyes. We can pick up obviously dry eyes in that situation, may manifest with burning, watering, red eyes, chronic allergies, especially here in Chattanooga. That's something can be picked up on a routine exam. What I see clinically in the exam with my microscope in patients who've got chronic allergies is if I have you look up and I bring down the lower lid, or I flip the upper lid, I see little, instead of a nice smooth sheen of the tissue, it's kind of bumpy, and they're little inflammatory follicles that present themselves. And you may not even be that symptomatic, but over time, if that's ignored, that will cause a lot of red, itchy eyes. In fact, I'm rubbing my eye right now because it feels a little itchy. So those are simple things. And then when I carefully look on the outside of the eye, just looking at the skin around the eye, especially here in the south where there's a lot of sun, skin cancers, melanomas are very common. So any little bump around the eye, often in the inner corner right there, right over there. I had a little basal cell cancer right there. It was a little bump there I was concerned about, had a colleague remove, and I was actually quite surprised it was a basal cell cancer. Basal cell cancers are often pearly looking and quite hard, and they are painless, and they grow very, very slowly. And the good thing about the basal cell cancer is it doesn't spread to the rest of the body, but it does infiltrate locally, and if you leave it and ignore it, it can spread locally, and you may even need the eye removed. I saw a lady just this week, she had a basal cell cancer taken off on the side of her nose by a dermatologist 2 years ago. Now she presented, and there seems to be another swelling there, but more of greater alarm is that she's got pain radiating up there, and there's quite a lot of tenderness on the lower portion of her orbital rim, on the bony tissue right there. And I'm a little concerned that the tumor may have invaded the nerves and gone towards the bone right there. So I've sent it to a facial surgeon to evaluate that for me. That's out of my realm of expertise. So now I saw a patient also recently. He had a pigmented lesion on the eyeball right below his iris, the colored part there, and it was bulging, and every time he blinked this thing would bother him. And I removed that. It turned out to be a melanoma. So melanomas are very, very serious lesions. I removed the entire melanoma, but the dangerous thing about a melanoma is it can spread unpredictably. So even though it occurs in the eye, it's unlikely to spread around the face, but he may end up with a liver melanoma or a brain melanoma. And so very early pigmented lesions around the eye need to be addressed. This particular gentleman had not only melanoma of the eye, but he had upper lid pigmentation and lower lid pigmentation, almost like kissing freckles of the upper and lower lid. And I had to biopsy the upper and the lower lid. I don't have that pathology back, but I am concerned that he has local melanoma as well. Melanoma also occurs on the inside of the eye, and that's why a dilated exam is very important. If you don't dilate your eye adequately, or if you go to a commercial place just for glasses and you think that's a satisfactory eye exam, I can tell you that's not a satisfactory eye exam. You need that pupil dilated. There are instruments, special cameras, that can get a good view all the way around to rule out a melanoma. So the one exception to needing a dilated exam is if your doctor has it's called a very wide field fundus camera, will pick up a melanoma or some other pathology without a dilated exam. Those cameras are pretty expensive, and you may have to pay out of pocket for that, but it's certainly well worthwhile to do that to prevent, to pick up a pathology. Routine eye exams also pick up very easy basic stuff like cataracts, glaucoma, macular degeneration. That's our bread and butter pathology here, and as one gets older, especially over 40, it's important again to schedule a routine exam to pick up all that stuff. One thing that I've picked up quite commonly in my office here is patients who've got sleep apnea that they're not even aware of. So patients, when they come and see me, I notice when I'm looking in the back of the eye at the retina, those veins in the back are very thick and dilated. And what's happening is if you're not breathing adequately, if you're holding your breath when you're sleeping, the brain and the body is deprived of oxygen. So in response, the body will make more red blood cells so that the blood can carry more oxygen to distribute to the body. But that manifests as big, thick, dilated veins. And when that occurs, the blood can be a little bit more sludgy and more likely to cause stroke, heart attacks, and even strokes involving the eye. So when I see these dilated veins, I ask patients about their sleep history and refer them to sleep centers around town for further workup. Now I'm just going to address a couple of questions we got on Facebook. Andrea wanted to know what the recovery time after cataract surgery was. And fortunately these days cataract surgery is very simple, outpatient procedure, takes about 10-15 minutes at the most. Very little discomfort. By the next day all my patients are back in their normal routine. For a few hours while the pupil's dilated, vision will be a little bit blurry, but by the next day when the pupil comes down, generally most patients are very comfortable and can resume exercise, lifting moderate weights, showering, etc. Usually in my practice, I do the second eye if that needs to be done within a week or two later, and it really doesn't slow you down at all. There's also a question regarding people who've had strokes and lost vision from that. You can get strokes of the occipital cortex, of the back portion of the brain is a part of the brain that interprets vision. And if you've had a stroke involving the occipital cortex, you will lose side vision on both sides. So side vision either to the right, to the left, maybe up there or down there. And it can be very difficult driving, looking at a rearview mirror. You won't be able to see that unless you really turn your head and use the remaining good visual field of your eye. There's no recovery from that, or very rare is it to recover full vision. You may recover some of that side vision, but it takes a lot of adjustment to recover from a stroke involving the brain portion, recover that side vision. I have Jamie, my optician here in the office, and she has worked with some patients to apply a little prism on one of the glasses to try to expand, to try to allow the good visual field to be put in the bad visual field portion. And she's helped some patients who are motivated to use this little prism. It's called a Pelly prism on the lens, but you really need to be motivated. But it may help some people drive. Hey, you've managed to help some patients with that.
Yes.
Get them back driving carefully. If you've had a stroke involving the eye itself, often patients will lose a lower portion of the vision to a variable extent. Some people have still 20/30 or 20/40 vision with that lower visual field defect, but that's unlikely to recover much, depending what's the severity. There's a question here about a 5-year-old daughter who the mom has noted the eye wandering, and for me that's an emergency. That needs to be seen straight away by a pediatric ophthalmologist, somebody who's familiar working with children, to rule out obviously a lazy eye, a cataract, a brain tumor, anything of that nature. Okay, so that we've spoken about. A couple of other questions showed up this morning. What might prevent vision correction to 20/20 even with glasses? Well, glasses will correct the focus of the eye. But if there's something impairing the ability of the eye to focus, like an irregular cornea, like if you've got a cracked windshield or a damaged cornea, you'll see through it, but it's not going to be that good. If you've got a cataract, if there's a clouding of the lens, that's going to affect clarity of the vision. If you've got a retinal problem, the retina is like the film in a camera, an old-fashioned camera, but there is a film in there, and that's got to interpret the signal, interpret the object that you're looking at. If it's irregular, if for example you need in order to see, you need a nice smooth retina. If it's wrinkled in any way, the film is damaged, you're not going to get a clear image, and it can be wrinkled for any number of reasons. The commonest cause is macular degeneration, diabetes. Those are the commonest. If there's been a previous infection, an injury, that will also affect the ability of the retina to interpret a nice clear image. If you've got optic nerve damage, so you got the eyeball like that and the nerve coming from the brain entering the eye, so the signal from the retina, next time maybe I'll bring some pictures and models for you to look at, but if the retina, nice smooth retina, has to signal to the nerve, which goes to the brain. So if there's a problem along the nerve, for whatever reason, whether it's a glaucoma nerve, whether there's a stroke to the nerve, whether there's multiple sclerosis or pressure from a tumor, that can all affect the transmission of a good signal to the eye and to the occipital cortex in the back. So I think I'm about done today with our discussion about...
you have one more
We
question.
did receive one live question.
Go ahead.
John wants to know, he's in a very sensitive group for contracting COVID-19, so he's not wanting to come out, but he is having declined vision. He's wondering if any of that can be addressed with a telemedicine appointment.
I'd be happy to discuss this with you, John, via a teleconference. I can get some idea what you're referring to. I don't know that I'll be able to get to the very core of your problem, but I'm quite happy to have this discussion with you.
Okay. That was it. Yeah.
Okay.
You were good. Yep.
All right. Thank you so much.